All right. Good morning, everyone. This is a hearing of the New Mexico Department of Health Medical Cannabis Advisory Board, and we will now come to order. I would like to welcome you to the public hearing where the Medical Cannabis Advisory Board will receive updates from the medical cannabis program. No new petitions to review for this meeting, and we will also hear comments from the public and to discuss the schedule for the spring 2023 meeting. Pursuant to notice, this matter is being heard the 6th day of December 2022 via a web-based platform and is being recorded. The time is approximately 9:04, and I am Stephanie Richmond, the chairperson for the Medical Cannabis Advisory Board. The New Mexico Department of Health Assistant General Counsel Chris Woodward will be advising the department during this proceeding, although I don't know that he has. This proceeding is being held in accordance with the Lynn and Aaron Compassionate Use Act, sections 26-2B-1 through 26-2B-7, NMSA 1978, and regulations at NMAC Title 7, Chapter 34, Part 2. If members of the audience have not already registered for this event, please register online so that your attendance may be noted and included with the advisory board submission to the Secretary of Health. At this time, I'd like to introduce each Medical Cannabis Advisory Board member and take roll call in alphabetical order. After my introduction, please announce your training, specialty, and interest in the Medical Cannabis Advisory Board. Good morning, Ariel. Ariel Bowers.
Good morning. My name is Ariel Bowers. I am a psychiatric nurse practitioner and nurse midwife. I practice in Albuquerque, New Mexico, in a private psychiatry practice that I own. And my specialty areas there are really perinatal mental health, substance use disorders, and trauma treatment. And so I have appreciated the opportunity and continue to appreciate the opportunity to serve on the Medical Cannabis Board to increase access to treatment modalities that patients themselves find helpful, and that people themselves, are seeking relief from particularly their trauma symptoms and their substance use disorder symptoms. So thanks. Good morning.
Thank you. I don't see Mordecai Bronner on or JP Dadam. Is Rachel Goodman logged on? Nope. And then Cynthia Griebler.
Hi, I'm Cindy Griebler. I'm a family practice doctor. I have a varied background. I found out about this advisory board through JP. We work together as hospitalists. I have a lot of different interests, and with cannabis, I have an interest. I have an interest that I share with JP. Both of us do acupuncture, and we also have had many discussions about cannabis in the framework of oncology, but I think that there are a lot of other good medical uses for cannabis. I was an outpatient family practice doctor for almost 10 years, and then became a hospitalist briefly. And I've had a virtual practice for 2 years, and now I am starting my own. Well, I'm joining a concierge practice, so I'm going to be doing outpatient medicine again. And I think that I was having this discussion with Gary earlier. I think that it's really important to look at different modalities for people to use. I think that cannabis can be helpful in a lot of situations, but I also think that there are limitations, and that we really need to dig down to figure out what kinds of negative things can happen in the just when patients use cannabis and maybe hit a threshold, like we were talking about the new use for cannabis, which is for anxiety, and there are a lot of people who use this, but I think that it can cross the threshold and cause anxiety. So there needs to be a way for us to figure out what kinds of guidelines would be helpful for patients. So I think that would be a really good use of this board.
Excellent. Thank you. Courtney Marquez.
Hi, I'm Courtney, and I'm a physician assistant, and I work in oncology and rheumatology, and I am happy to be back on the board, and I'm very excited about medical cannabis as a adjunctive treatment for patient symptoms. Have seen a lot of patients have had a huge improvement with their pain management, anxiety, neuropathy with use of medical cannabis. So I want to continue to promote it and learn more about it and have this more a part of our general practice.
Thank you. Alan Plymouth.
Good morning.
Good morning.
Alan Flymill, a 50-year resident of Deming. I was a pharmacist for 31 years and then had an opportunity to jump over and become a clinician at an internal medicine clinic. And very happy when I got a chance to come on this board. My interest is the judicious and safe use of cannabis products for patients in need.
Excellent. Thank you. My name is Stephanie Richmond. I'm a physician assistant. I'm a primary care provider at the University of New Mexico. I have really seen how patients get significant benefit from using cannabis, and I'm interested in continuing to pursue additional petitions that would be qualifiers to allow access for our patients to use this as a modality. How about Tracy White? Good morning.
Good morning, guys. I'm Tracy White. I'm also a pharmacist. I practice in oncology and palliative care in Las Cruces. I'm also an assistant professor pharmacy practice for the UNM College of Pharmacy. I became interested in cannabis when I worked in hospice care. I did that for 9 years prior to returning to oncology, and always with the focus of symptom management, counseling patients on dosing and interactions, drug-disease interactions. So I still have a place in wanting to help folks with all of that. Thank you for having me.
Excellent. Thank you all for participating, fellow board members. There are 6 of 9 advisory board members present, and we have therefore established quorum. We will now proceed with the hearing agenda. Since our last meeting, we have had a new appointment to the board. So thank you, Cindy, very much for your introduction, and we look forward to working with you and your participation. I'd also like to thank Dr. Davin Quinn for his term with the Medical Cannabis Advisory Board. His insight and participation were very much appreciated. I motion to approve the minutes from our last meeting that was on March 22nd, 2022. And this meeting was recorded and may be viewed on the Medical Cannabis Program webpage. Is there a second for the approval of the minutes?
Second.
Thank you. At this time, I invite the Medical Cannabis Program to update us regarding their activity and progress. We'll be hearing about updates from the Secretary of Health regarding our last petition for inclusion of anxiety disorder and any other activities they'd like to get us up to date with. So thank you. We look forward to hearing from you.
Good morning, Stephanie, and all the other committee members. And Cynthia, welcome to your first board meeting. This is Dominic Zerlo. I'm the director for the Medical Cannabis Program. And I'm just going to briefly, we talked in the last meeting about how we're putting up our monthly statistics and our reports on the website. So I'm just going to show the last one, which is complete, although November, we are working on the final touches, and that we anticipate being available anytime in the next few days. So you can continue to look at our website to find that, and I'll actually show where on the website these documents can be located. So I'm just going to share my screen. So I apologize to anyone if it suddenly the screen changes a little bit. Can people see the screen? Okay.
Yes.
So this is our statistics report from the end of October. Each of these reports is done at the very end of the month. We pull the data starting on the first of the following or of the next month. So we pull this in the beginning of November. And we really haven't seen that much of a change. We have, and this was anticipated, seen a reduction in the number of enrolled patients within the program. And at the current point, I can say for November, that number has been consistent and is at about 116,000. So you'll see here it's at 119, just under 120,000. So we had about a 3,000 reduction during the month of November. Now, this again is consistent with what we thought would happen with the advent of adult use. We anticipate this trend to continue for a little while before we end up seeing a leveling off and then an increase in the enrollment of patients. The percentages as far as the criteria and the qualified conditions that patients are enrolled has not changed very much at this point. As far as from one condition to another, that has actually stayed very stable, even with the changes in enrollment. And the same is true as far as with the county. And so on this second page, it shows, and it has both the grid for the numbers of the patients enrolled per county, and the grid is actually done in from highest to lowest with the number of patients who are enrolled. And then it actually shows the geographic map showing who is enrolled in which counties. We did start adding a couple of months ago showing the percentage of patients, and this is percentage of patients as compared to overall patient enrollment in each county. And so we do have the map for that as well. And then we have, along with that, is the table with the information showing what the overall population in the county is, what the county population is to total state population in percentage, what our enrollment was by county, and then the enrollment in total percentage for medical cannabis program. Now, the demographics, again, these ratios have not really changed very much within the program. They have stayed very stable. You are welcome to go back and look at the previous documents to be able to see how and what areas those have changed. The same is true in race and ethnicity, gender identity, and within the age ranges. And I know the age range is one of the areas where people have had a lot of questions about in the past, and where especially people will say or will report to us that they think and believe that there is only 1 or 2 ages where people are enrolled in the program. And I really think that what this demonstrates is that we have patients that are enrolled in the program across all ages within New Mexico. And it's actually very consistent within the age groups. While we do have some more patients who are enrolled who are in their 30s, and some more who are enrolled who are in their 60s, it is actually pretty consistent across each age group if you look at it in the 10-year age groups. And of course, under 21, that is a little bit lower, in part because of the requirements for caregivers for minors. And then this is actually showing our 5-year enrollment trends. And with the 3 most commonly enrolled conditions going back for the past 5 years, giving a snapshot of what has been happening within the program. And you can actually see again, they have remained fairly stable with a little bit of adjustment percentage-wise with these top three different conditions: post-traumatic stress disorder, severe chronic pain, and cancer. And then again, the monthly enrollment trend showing really since December 2021. The reason we include December on here is because, again, as I mentioned before, this is the snapshot of what enrollment looks like on that last day of the month. So December 31st of 2021 really is equivalent to January 1st of 2022 as well, because January 1st is a holiday, so we are not doing enrollments on that particular day. So this actually really shows and does really well at showing what the enrollment within the program has been within the last year, and showing that trend with our peak in April, and then after adult use becoming legal for distribution and sales, we're seeing that reduction in enrollment. And again, as I mentioned before, we expect that to continue for a while, level off, and then increase, which is what has happened in other states that have gone through similar programs of having a medical cannabis program and then introducing adult use cannabis. And so these final two graphs in here are similar to on the page before, but showing on the monthly basis rather than each year. And again, as you can see, if we look at the three most commonly enrolled qualifying conditions, which again is PTSD, cancer, and my apologies, and severe chronic pain, what we end up seeing is they are actually very level and very stable from a percentage wise as far as enrollments within the program. And so with that, if there are any questions regarding some of our data and the statistics, I am more than happy to answer them.
That looks great. Thank you very much.
Now, I do have one other item that, oh, and I'm sorry, I was going to show where these are located on our program website. And this is on our educational materials and resource page. And they are down under the publications. There's a section that is reports with patient statistics, and it includes all of the statistics going back, as you can see, for several years. So all that is available to anybody through our website. We also do have a lot of educational materials that are available on the website, including with regard to information about storing cannabis, safe usage, pregnancy with pets, a frequently asked questions guide. And just as an example, I'll go ahead and pull up the first one, which is about safely storing. This is the bilingual version, so both English and Spanish, and really has information for both medical providers and patients to be able to utilize, to be able to help provide some information, in this case on safe storage for patients, to ensure that the cannabis is in locations where it's not going to be accessed by small children, pets, or others. And the other thing that I also wanted to let everybody on this advisory council know is we have talked before about how the program is continuing to move towards electronic systems, including our online patient portal, which was introduced last year. We have actually now taken the next step, and some patients actually found it earlier, because while we had started working on it and working through making sure there were no issues or problems or glitches on it, we have now announced and have released an electronic card for patients. And so a letter went out to all the licensees, so the dispensaries, yesterday, announcing that patients could go ahead and utilize that. We have also changed some of that information on our program website. So for example, if someone goes to our patients and caregiver section on the webpage, it actually discusses the electronic applications, the paper applications, and the fact that there is right here, you can access your electronic card upon approval. So what this means is that patients can actually go through their approval process. And if they're doing it online, as soon as their application has been approved, they can access their electronic card and then purchase cannabis utilizing that. This helps to reduce down that mailing time, which we know has been an issue for many people and in many areas. For example, sometimes we will have the address for the patient will have changed from when they applied to the program till when their card was approved. And so the card would get returned to the program and we would try to track down that patient. And once we were able to do so, we could mail it out, but that would create a delay, which was unfortunate and problematic. And so by having this electronic card available, once somebody enrolls in the online system, they will be able to access it, and those kinds of issues will not be a problem. Another issue that would happen is if somebody lost their card and they had to request a replacement card, that of course would take some time. Now those patients can simply access their electronic card without having any interruption in their ability to access the medicine. So this is a very big step forward for the program and for patients, especially ensuring that patients are able to access medication whenever they are enrolled in the program. So we're very proud and very pleased to be able to present this. There's additional information going out to the public and through the website over the next week or so to make sure that people are aware of this change and of this improvement in the program. So any questions regarding this? Okay. Oh, Cynthia, I think Cynthia had one.
Oh, I should change that to Cindy. But where on the website is the educational information again?
Oh, most certainly. I'll actually walk through. So if someone goes to our home page, which is this page right here that I'm showing now, they can either go to the educational materials. That's actually the best way. I'll keep it simple. And if you just click on this here in the menu on the left, you can click on that and it will take you to the educational material and resource page.
Okay.
Okay. Oh, Ariel.
Hi, I do have a question and a comment. Actually, I appreciate these innovations in terms of ease of use. I know, like as a clinician, I have appreciated the online portal for completing applications, and my patients have appreciated how quickly those are getting processed. And then the educational materials and the electronic card, I think, is going to be really helpful also. And then I have a question that comes from my patients and from kind of like from the public that has to do with cost. So there has been like an increase in cost of medical cannabis since recreational cannabis became like available and legal in our state. And I don't know, if, like what is, if there are some systemic ways that this is being addressed, but I wanted to check in with you all about it because it is an increasing concern that I'm hearing from our patients.
Thank you, Ariel. And we have heard that as well from patients as they call into the program, that the costs have been increasing. And I am sorry to say and to hear that that happens and has been happening. Our concern, of course, from the program is that the costs remain as low as possible. Unfortunately, it seems as though many of the producers and distributors have been increasing those on a regular basis, not just even at the point where when adult use first started, because we saw a definite spike at that time. But it seems that the overall cost has increased. We are looking at doing some additional surveys to find out if that is a perception or if that is reality. But it seems that we've had enough people who have made those statements that I think you all have a good idea of where that's going to fall. But again, we need to do a little bit more surveying and find out some of that information. As far as from a systemic issue, that is something that I do know that falls within the Cannabis Control Division. as far as the regulation of all the licensing and the sales that no longer falls within Department of Health. So all of that regulatory aspect falls over with the Regulation and Licensing Department with the Cannabis Control Division. So my appeal would be to dispensaries and to cultivators to lower the price to be able to make it more affordable to patients, because several of the things that had been requested that would say that that prices would reduce have actually occurred at this point, and yet we have not seen those prices drop yet. That includes additional licenses, more plants, more locations. And so while access, I think, is much better than it has been before, and I think that that's a very positive thing, we really need to ensure that medication is affordable for patients. And so, yes, if there are ideas on how that can be done at this time, we would be all ears to hear that and to pass that over to the Cannabis Control Division.
Okay, thank you. Appreciate that.
Okay, any other questions? Okay. Thank you, Stephanie. I appreciate it. Are we going to Gary next? I'm sorry. With opening up my screen, I lost my agenda.
Yes. I have the pleasure of officially sharing the final decision with regards to the petition on anxiety disorder that was heard by the board back on March 22nd of this year. So it's great to see everyone again. And yeah, we have another exciting announcement here. So I'm simply going to read the decision as it is here, and this will be posted later today on the website as well. So essentially, per Secretary's Grace, I'm adopting the recommendation of the Medical Cannabis Advisory Board that the Department of Health add anxiety disorder to the list of debilitating medical conditions qualifying for participation in the New Mexico Medical Cannabis Program, effective January 1st, 2023. And I do want to highlight the effective January 1st, 2023, because though this is the final decision, it will not be in effect until then. And so we do ask the providers not utilize this diagnosis as a qualifying condition until January 1st, of course. But again, this is another exciting development. And I would like to share just a little bit more from the decision, because I think that this is a great shout out to the advisory board. It says here, given that the core argument for the inclusion of anxiety disorder as a qualifying condition is the perceived benefit of increased provider oversight, I would ask that the Medical Cannabis Advisory Board develop informative materials to ensure safe use. Any recommendations the Medical Cannabis Advisory Board could propose to help providers avoid the anxiogenic effects of cannabis use would not only be useful information for those suffering from anxiety disorder, but for all qualifying conditions as well. So again, I think that the board has some great insight with regards to anxiety disorder. And I know that through the meeting, the discussions that day, that there was a lot of advocacy for the provider's role in that. And so, you know, I'm not sure if this is a topic of conversation for the meeting today or for meetings in the future, but if the board in its wisdom has tools or techniques to help patients really navigate that fine line between utilizing too much cannabis and creating anxiety, as opposed to truly benefiting from the alleviation of anxiety as a symptom. So yeah, I'll turn the time back over to you, Stephanie. But again, that's the official recommendation.
Excellent. That's excellent news. Thank you very much for sharing that. Yes, Dominic, did you have a comment?
Yes, I actually, I just really wanted to say, I wanted to say this part during the presentation about some of the data, but wanted to wait for the announcement. One thing we do think that will change with the addition of anxiety is we do think we're going to see some changes with regard to the PTSD diagnosis. So in future meetings, when we have some additional information on it, I think you're going to see those percentages for PTSD change, because one of the things, and we've discussed this before in some of these meetings, is that sometimes PTSD becomes a little bit of a catch-all for some of the other diagnoses, and this may include anxiety. And so one of the things that we're actually very very much looking forward to from a research data collection standpoint is seeing how many patients actually come in with regard to anxiety. And so that'll be something that'll be very interesting in the data, and we do anticipate that changing. I also would like Gary to mention, if possible, his webinars that he has been doing.
Certainly, yes. We've been doing a forum for medical cannabis providers that certify patients for the program, and we've been doing it on Thursdays, every other Thursday. We've had 3 meetings so far. We're not doing any for the month of December, but we will be having one the second Thursday in January. And we've had a wonderful attendance of medical providers that have been certifying patients, and we've been able to talk about the program, talk about the portal, because again, we are going fully electronic, and educate the providers on how to utilize that and troubleshoot when they are having issues with the portal, and we're there to help, of course. Also, we've been able to discuss some case studies with regards to specific patient encounters. I field lots of phone calls from providers that have very unique patients. And so from that, I've been able to create some case studies that have we've been able to discuss, what would the proper diagnosis or qualifying condition be, but also discuss routes of admission. We had a wonderful discussion about tinctures of RSO, and it's been also, it's been fun to bring the community together in a way, because, initially when we did this, we weren't sure of how providers would how much they'd want to share. But I have to say, it's cameras on and voices loud, and people are definitely talking. And so I hope that this continues, that the inertia continues with this, because I think as providers get to know each other and we troubleshoot. For example, we were talking about reciprocity outside the state and how different every state's reciprocity is. It's not as unique as ours, or not as welcoming as our reciprocity. And so that was something that we were able to really field through one of these forums. And so I think you've all received invitations, but we'll send them out again, and it'd be great to hear from board members at that as well. And of course, many of you are certifying providers. So stay tuned.
Excellent. Thank you very much. All right, so this month we don't have any new petitions from the public to report on this meeting. I would like to invite fellow board members to consider participating in the petition process. I move to have an open floor discussion regarding potential future petitions. Is there a second for an open floor discussion for board members?
I'll second.
Excellent, thank you. I know I was doing like a review of some other states to see about other qualifying diagnosis, and when Dr. Dedam and I were working on the anxiety proposal, another thing that that we were also looking into at that time was about insomnia. Other qualifying diagnosis, although the research is really difficult to try and find anything for that. So the other things that other states have as qualifying diagnosis are chronic pancreatitis, sickle cell anemia, migraines. Those are other things that we don't have listed specifically on our qualifying diagnosis. Cindy, it is possible, just to get you up to date with some of the other things for the board, it is possible for us as board members to present a petition. If a board member submits a petition, then they are not allowed to vote on that so then it is really important that we make sure to have a quorum for that day, so that we can have good feedback and support from all of the board members. But I wanted to be able to kind of use this forum as a way of being able to discuss potential petitions that people might be interested in trying to include and get some other feedback from my board members. What do you guys think?
So I do think that there's some interesting categories that we end up using, right? And so, I mean, I think that, you know, where we're looking at like migraines and sickle cell anemia, both of those things tend to fall under the category of probably chronic severe pain. And, you know, it's just that maybe it's like you would have to do some more nuanced work to be able to put that into a note and justify use, right, as a clinician. But I do think that, you know, like, I think it is interesting to like look at, you know, separating those things out and access, right? I think if people say have a diagnosis of sickle cell anemia, it may be easier for them to access like medical cannabis program through their like primary care provider, because that would be much easier paperwork, right? And then also it may be useful for like patients to recognize, you know, to say like, oh, I have sickle cell anemia, and this is an indication for medical cannabis. And so, you know, like that may be able to match a little bit easier. So maybe that would help me with my pain if we have like, you know, like adequate research to support that, which for chronic pain, I think we do. It's just, it's interesting, right? Whether we want to go with like broad categories or whether there's benefit to like having more diagnoses that are specific to clinical circumstances.
Yeah, I totally agree. I think sometimes my thinking about having those more specific diagnosis was exactly that, like being able to maybe have ease from the clinician side, but then also just being able to recognize that, yes, this is something rather than under a broad category of the chronic pain, and that has been used so many other times.
I also think a little bit about insomnia. And I mean, I think about like the people, you know, that I take care of who have post-traumatic stress disorder. And I think actually the main indication that, well, like at least in my patient population, primarily people are using it for sleep, right? Because it's helping to reduce those particular symptoms of PTSD, right? And so I would say that's the most common piece of that. And then also like being a person in psychiatry, I think that a lot of people do not, they may really recognize their anxiety and they may really recognize their depression, but they may not actually realize that they have PTSD, right? Until they see someone who can properly diagnose it and really talk with them about it and think about it in a therapeutic context. So I think it makes sense to look at insomnia, honestly. I think that it could, I mean, I think a lot of people do use it for insomnia.
Yeah, I have that feedback from my patients as well. I definitely agree with that. I think the challenge with that one is really trying to find some other good documentation and research. That's always going to be the issue. Although that is something that has also changed on a federal level, and some other cannabis research will be able to start happening. So I'm really excited about that part as well. And that might also eventually affect how we're able to include other diagnosis in the future. Okay, so I'll start doing some digging for some insomnia. If anybody comes across any other documentation regarding that or interesting studies, send them my way, and we'll see about trying to work towards getting some additional petitions going for our next session. Anybody have any other ideas about other qualifying diagnosis?
I have an addendum to the insomnia issue. Insomnia can lead to sleep deprivation that can cause a whole plethora of symptoms. So I think that would be a very good one to research extensively and try to get included in.
Nice. That's, I'm glad to get that feedback from everybody. Yeah, Cindy.
And with patients who have obstructive sleep apnea, especially the ones with PTSD, sometimes the mask is really, for those people who are claustrophobic, and just the whole process of using CPAP is really difficult. So that can be helpful.
Yeah, for sure. I saw the numbers for the sleep apnea. That one seems like several people have been qualified in the program for that.
Right. So
Right.
it's, I think that's why that's part of it, because it's got both indications.
For sure. All right. Well, good. I'm glad to hear that there are some support for a couple of other diagnoses. So we'll see what we can come up with over the next 6 months. Did board members have anything else to talk about before we move on to the public comment?
I had I wanted to talk about something that Gary and I were discussing. And this is just to throw this out there and see what other people think. We were talking about the fact that now that there's an anxiety diagnosis, that's a possibility, you know, with the caveat that was put in as far as anxiety producing effects of cannabis. I think it might be interesting to figure out if we could apply for some amount of funds, like as a legislative thing, to maybe look at case studies and talk about trying to drill down like what the thresholds are for anxiety provoking symptoms. And I think that Gary had said that initially that there was some conversation about collaboration with UNM, and I just think that the more information that we have that we can give to patients, the better that's going to be. So I'm not exactly sure how that would look, but I think that we can talk about a lot of things, but having some resources to put together better information for patients would be really good. So I don't know, you know, how that would come about. And Gary, I'd love for you to talk about what we were discussing.
Yeah, as we were working on Cindy's connection yesterday, one of the topics from one of the forums a couple weeks ago, there was a patient, a young girl with seizures, and the amount of product that was being used, it was a super high concentrate. It was rather very pricey. And so the topic that was discussed was, you know, there was a non-for-profit foundation that had been established to help patients obtain, you know, product. And so the question was, well, you know, how could that happen here in New Mexico? And again, this is something that, you know, board members could discuss, or, you know, take on that challenge if they want to. But again, it was a unique case, and I think that I do not think that that foundation is currently around anymore. I think it devolved. And so, you know, as Ariel was talking about prices earlier, you know, it is a concern out there. So, you know, I'll leave it to the board to discuss and come up with those ideas. But yeah, that is out there. And so it is a topic that you could definitely discuss. I'm not sure how the voting would take with regards to, it's not necessarily a qualifying condition, but again, you have some great providers here. So I implore you to converse.
And we were like, the conversation that we had was because I have a friend who is involved in cannabis, and we were talking about putting together a foundation, but he's in Virginia, and the whole crossing state lines thing, not such a good thing. And my friend Stephanie, who is very involved in cannabis and patients, who's an RN, she said that the foundation that she used to deal with, and this is, I think, primarily for breast cancer patients, has dissolved. And so it doesn't seem like there is that resource, but it seems like with the number of businesses that have popped up over the course, I mean, every time I turn around, I see another cannabis dispensary. But there are some really large businesses that are selling cannabis. I think that they would probably want to contribute to some kind of foundation. Just, I mean, even if it wasn't altruistic, but just as like a tax write-off kind of thing. And that might not be a bad thing, because then if it was something that was maybe through the state, and I don't know how that would work, it could be a good way to get information, better information, to those people who are dispensing cannabis, because there's just such a there's such a difference between different cannabis providers in terms of information that they tell to patients. And some of the dispensaries are great, and some of them like have almost no idea what they're talking about. So it's just an interesting dilemma as far as patients trying to get good information from the places where they purchase cannabis.
I agree with that. What about, so your friend in Virginia has work with the foundation? Do you have?
He hasn't. He's never
Oh,
worked
no.
with the foundation, but he grows. And so I was thinking, wow, this would be a great, this might be an interesting collaboration to see, you know, like if he were interested. And he keeps asking me like, okay, what do you think? And, you know, I think we're sort of like what Gary said with cannabis and crossing state lines, that's probably not an option. So I was just wondering like what your thoughts about that would be, and just having that interaction between cannabis providers and like not only having something that would help us to reduce the price, but also dispense information at the same time is a good thing.
Another issue that I forwarded to Gary recently was the College of Pharmacy was putting on plans to educate pharmacists in cannabis, as far as its use, its interactions, contraindications, things like that, and somehow including them within the industry to help primarily with education and avoiding serious issues that can come from it. For example, last time I looked up, there were at least 29 serious interactions with regular pharmaceuticals and more than 350 lesser interactions. So it, to me, becomes a reasonable thing to broaden information in all respects.
Yeah, I think it would also be nice to be able to provide that other kind of patient education to providers, and maybe then it would be able to allow them to feel a little more comfortable in talking about it with their patients too. Yeah, Dominic, did you have a comment?
I did. Thank you, Stephanie. And I just want to, just because some of the comments sort of started going into some of the things that need to be done. And I just want to remind the board that there is a very specific scope with regard to the Medical Advisory Board. And that is with regard to looking at patient petitions, adequate supply, that kind of information. So while there is a definite agreement that additional funding and monies are needed with regard to research, that would not necessarily be for the board itself. The board would be looking at reviewing, gathering, or collecting the research to make recommendations, not actually conducting the research itself. Although that is something individual members can, of course, proceed to do. So I just wanted to make sure that that's clear, just because we don't want to get into a situation where we're turning around and requesting a budget for something that, according to the statute and the requirements, we can't do. So I just want to make that clear. But research and providing information is definitely within, or the providing of the information from research is within the purview of this board. And it's actually one of the things that the secretary is requesting, especially with regard to anxiety, is help. We would like that additional help and your expertise in making sure that we get the best information out to providers, and to dispensaries and to patients that we possibly can. So thank you.
Excellent. Thank you.
I do think that it would be like I will take some time just to look at what we have in terms of best use and practices for like cannabis medicine in the context of anxiety. And if, you know, like I have a feeling there actually, like there are other things already out there in the world that other people have published. And I do think that I think that actually the like Dr. French and his work with like the Project Echo kind of medical cannabis, like I do think that that is probably helpful in terms of gathering information and exchange of information with clinicians. But I think it would be lovely to have a best use document in terms of just an info sheet, right? Like you have for safe storage of cannabis on the website. And so I'm happy to do a little bit of work on that. Probably not make a full handout, but definitely I would love to help. And I do have, I know that this is not purview, right? Thinking about like access in terms of like how to make things less, like less expensive for our patients, to make their medicine more affordable. But I think that I do have some concern. I think what I need to know is that it is being looked at in other places, right? If it is no longer part of Department of Health and your job to really be like, okay, how do we make this affordable to people? It's no longer under our purview. Like, are there people that are looking at equity and access and cost in other parts of the government? And if not, like, there's some advocacy work that needs to be done or some collaboration work that needs to be done, right? Because, as Cindy was saying, I think there are a lot of people who are making a lot of money on recreational cannabis. And I know that, like, it's not my job here to be like, we should make sure that people can get their medicine. But I do think that we should make sure that people can get their medicine as much as possible in terms of advocacy.
And Ariel, I completely appreciate that, because I agree with you that one of the things we have always wanted to do is to lower those costs for the patients and to make sure that that continues. There is, over at the Cannabis Control Division, or I should say attached to them, is the Cannabis Regulatory Advisory Committee, or CRAC, and that is one of the things that they are looking at and that they are doing. They are making recommendations with regard to regulations and operations and all of those sort of things. So it's more that it has shifted away from Department of Health. And there are a lot of variables. For example, with many of the dispensaries and the locations starting up, they do have their startup costs. So in the very beginning of any kind of a new industry or operation, you're going to see some increased costs that come in. My hope and my hope for the patients and for the program overall is that many of the dispensaries are able to minimize those and the burden that they face, or that gets passed on to the patient, and that we're able to see that start to reduce now that those initial phases have actually passed or are still passing. I mean, it takes time to build an industry, and they really are doing that. And so we understand that. We just hope that those prices start to come down for those patients. But I do know there are many that are working towards that goal, and there are some that they still offer specials for patients. They offer additional things, but sometimes it's a situation of being in the right place at the right time. So my hope is that becomes more consistent over in the future months. And, we still have many dispensaries and providers who really care about the patients and are trying to do the best that they can for them.
Excellent. Thank you very much. Any other board comments?
So are there information sheets for all of the diagnoses? Like, just as a general thing? Like best practices and, okay. Just wondering.
No, I do find that it's some interesting feedback from the secretary. If the anxiety diagnosis had gone to the Secretary of Health more than once, so interesting feedback that we get for that diagnosis compared to others. So, but I mean, anything to help with patient education, I also think that that's really helpful. So I appreciate the efforts at Ariel for helping to work on that. I'll also do some digging into that as well. And it would be really nice to be able to put some things like that on the website, because there's a lot of information that the department has there. So I really appreciate that. All right. So if the board doesn't have anything else to discuss, we'll move on to the public comment section. Individuals who have pre-registered for the meeting and have requested to make a public comment will be able to comment first and should limit speaking time to 3 minutes. If you have not previously requested to make a public comment, please click on the raised hand icon on your computer or dial #3 if you're calling in by phone. I ask for assistance from the Medical Cannabis Department with calling on the speakers and for monitoring their time. For those of you unable to make public comment during the meeting, the public comment period will be open for 48 hours after the meeting. Please send all public comments to the following web address: medical.cannabis@state.nm.us. Thank you, and we look forward to hearing from you.
Okay, the public comment period has begun. I have Miss Caffrey waiting for a comment. I'm going to unmute you and then your 3 minutes will begin. Here we go. You can unmute yourself, Miss Caffrey, and I will begin the timer.
Thank you. Good morning, Advisory Board. My name is Christina Caffrey. I'm the in-house counsel for New Mexico Top Organics Ultra Health, which is New Mexico's largest cannabis provider. We believe strongly that affordability, one of the best ways to address affordability of medical cannabis, is by securing insurance coverage for medical cannabis. To that end, Ultra Health has partnered with several medical cannabis patients to actually bring a lawsuit against insurance companies to secure insurance coverage for medical cannabis. We have about half dozen medical cannabis patients who are class action representatives. They are representing all of the more than 100,000 medical cannabis patients in New Mexico. And we are suing Blue Cross Blue Shield, Presbyterian, other insurance coverages, and that includes Medicaid, because we believe that if insurance coverage is secured, accessibility and affordability will go a long way toward being solved. So the numbers for that lawsuit, I can give them to you right now. In state court, It's D202 CV 2022-03237. In federal court, it's 1:22 CV 00546. If you want more information about this lawsuit, feel free to email me, Christina@ultrahealth.com. It's Christina with a K, KRISTINA@ultrahealth.com. And the basis for this lawsuit is several state statutes that have established that there should be no cost sharing for behavioral health services, and that health insurers are required to provide certain essential health benefits. And we believe that if this lawsuit is successful, the lives of medical cannabis patients will be improved extraordinarily. I also want to point out that the Department of Health is still under a statutory mandate to report on affordability. It is 26-2C-4D. That's part of the Cannabis Regulation Act. It says, in consultation with qualified patients and primary caregivers, the Department of Health shall publish an annual assessment report that shall include, at minimum, an evaluation of the affordability and accessibility of medical cannabis. That's a carryover from the Compassionate Use Act, which in 2019, that was amended to include a mandate for assessment. 26-2B-6.1, in consultation with the qualified patients and primary caregivers, the department shall produce an assessment report annually, at minimum an evaluation of the affordability and accessibility to medical cannabis. To my knowledge, the Department of Health has never produced that assessment report. So if the board wishes to know about affordability and accessibility, the Department of Health should produce the assessment report, which it is statutorily mandated to do.
Your time is up. Thank you.
Interesting.
If there are others who would like to make a public comment, please use the raise hand icon up above at the top of your screen. If you're calling in, since our platform has changed, you can dial *5 to raise your hand. Otherwise, you can also let me know in the chat if you would like to make a comment. Okay, it looks like that's it. If anyone has any additional comments after this meeting, please feel free to email us. Thank you.
Excellent. Thank you all very much for your time. It's always a pleasure to work on this board, and I appreciate all that you do and your work with patients and medical cannabis. At this time, I'd like to propose that the members of the board discuss dates for our next Medical Cannabis Advisory Board meeting. I suggest Tuesday in March 2023. I motion to have an open floor discussion at this time to discuss meeting dates. Is there a second?
Second.
Excellent, thank you. So what day works for all of you for sometime in spring 2023?
All Tuesdays are good for me.
Excellent. How about March 7?
That works.
Okay, perfect. So I motion to convene the next Medical Cannabis Advisory Board meeting on March 7 at 9 o'clock. Is there a second?
Second.
Excellent, thank you. All right, I think that convenes the meeting today. I motion to adjourn, and we'll see each other on March 7 with 1 month posting prior to that on the website. Is there a second for adjournment?
Second.
Excellent. Thank you all very much. I appreciate your time.
All right. Thank you, sir.
See you in March.
Bye.